Hello, and thank you to our 7th annual State of the Agency address. Happy New Year, everyone. And I want to thank the IT team, Kevin, for providing this live stream today. With the technology that we were able to install and put in this new building and within our network, we have this capability. So that's a wonderful thing. So as I said, this is my 7th address to you. I don't want to see that. And as you know, this is my last. This one may also be a little longer too. Not only have we accomplished much over this last year, but we have many initiatives that are ongoing and planned for this next year. Fortunately, in 2022, we were able to scale back greatly our all-agency response to COVID-19. Except, of course, for our communicable disease staff. They continue to respond to COVID cases, although in much less numbers. And although our COVID response diminished, Mpox then took the stage, then Ebola, and currently a much more severe flu season and increase in RSV cases. There is never a dull moment in CD or in public health. Fortunately, we are recruiting for more staff in the CD department and hope to have them fully staffed soon. As you can imagine, experienced CD staff are in high demand at this time. After more than 2.5 years of operation, our operations are still affected to some extent by COVID and those other illnesses. And since we are such a global society, this is probably the new normal. The Community Health Center and our immunizations department are still providing COVID vaccines as requested, along with flu shots and their normal line of services. As always, we continually are looking for ways to improve our methods, our processes, and services, and 2022 was no different. Let's look at some of the highlights of this past year. We added 2 leadership positions. We now have a director of admin services and an assistant director in family health services. We modified 1 management title and added 1 new management position. Vaccine equity manager is now health equity manager, and we are currently recruiting for the safety risk reduction officer. We installed card access locks and additional security cameras at the Community Health Center to improve security. We were awarded over $3 million at the Community Health Center and $7.8 million in the Health Department from federal ARPA funds for program enhancements, services, and staffing. We began our call center project to centralize our telephone communications and provide better customer service. We completed a very successful branding and recruitment campaign. We added our substance use treatment program and Dr. Kathleen Burke's substance use risk reduction team to our behavioral health programs, as well as began the rollout of the 590 program in behavioral health. The Community Health Center started a school-based health center at a Bolingbrook Middle School. The Community Health Center began its renovation of space to provide a brand new 8-office behavioral health patient suite. Will County Health Department was chosen amongst hundreds of local health departments nationwide to showcase our agency, building, and programs to the NACO delegation in December. We initiated many improvements in communication and services to our branch offices, mostly due to the addition of our Director of Admin Services, and we now have designated branch office liaisons at both sites. Safety will continue to be a priority in 2023. So these are just a few examples. I know there are more. If I've left out an initiative of yours, I apologize, but there's a lot to keep track of, and we do a lot in 1 year. So let's talk a little bit about budget and finance. Fiscal 23's budget is $38,637,640. It's an increase of about 10%. During the county budget preparation process, the county board voted to approve an additional $1 million levy to add to our already $10 million levy. Our projected fees are slightly higher, as is our projected grant revenue. We will experience some increased billing rates for behavioral health services, something long in coming. We still have several staff funded by COVID-19 grants, one just ending December 31st, one ending March 30th, and one ending June 30th. This grant funding has allowed us to hire multiple new staff that have been integral in enhancing our COVID response and related services. So on the horizon for 2023, as we continue to perform our mission, remember that this is what we're here for. This is public health. And because of COVID-19, our community now has a much clearer idea of who we are and what we do. We need to continue finding ways to promote our programs and services so that our toil continues to have a positive impact on our community. So let's talk about some of the things that are on the slate for 2023. With the addition of the compliance officer position, we will continue formalizing our compliance and privacy policies, our assessments, monitoring, and training. As you know, we recently automated our incident report form and will be refining that process as we continue to use the form. This digitization will provide us with real-time data and the ability to identify trends. The compliance officer will also continue working with all divisions to ensure we have a robust and effective compliance program. We also anticipate continual improvements on our website and social media platforms. Kevin Juday, our new media services manager, is working on several upgrades and changes on our website and on our communication platforms. Two key improvements so far are the standardization of our Facebook, Twitter, LinkedIn, and Instagram handles. Now you can find us at Wilco Health on all of them. He will also be working with a professional marketing firm who will be utilizing their talents and expertise to further market the Will County Health Department and Health Center brand. Optimizing our brand will help boost our recruitment and hiring numbers, market for our new substance use program, and for the general services of the Community Health Center. Prior to COVID, we never utilized the services of a professional marketing firm, and we've seen their effectiveness and want to make the investment in our entire agency. In 2023, we will complete our agency call center. Currently, we have multiple staff in many divisions answering phones and making appointments. The call center staff will be trained on customer service best practices, will be given all the resources they need to answer questions, they will have expertise to make appointments, and they will be managed by our operations coordinator, Christy Cage, who has several years of operations and call center experience. As you know, we recently rolled out a new client-patient survey, thanks to Carol Ricken, our community engagement manager. It is fully automated and ready to go for continual process improvement. We will also ask our community partners to complete a survey every 6 months to assure beneficial working relationships with our collaborative partners. Both surveys are automated and can provide us with real-time data that is helpful in making decisions about staffing or programs. I encourage you to request our clients, patients, and customers complete the survey and tell us how we're doing and how we can improve. Our vaccine equity manager is now our health equity manager. Vanita Voss has begun working with all divisions to apply that equity lens to our programs to optimize our outreach and services to those who need it most. As I mentioned earlier, we are bringing on a safety risk reduction officer for oversight and management in all things related to safety. As you know, we have made several safety upgrades to all of our buildings this year and will continue to do so. Regular training, drills, assessments, and audits will take place for continual process improvements for the safety of our staff, clients, and our buildings. Our most recent active shooter training is almost complete, and then we'll move on to the on-site exercises for those who want to participate a little bit further. Although the Community Health Center was awarded their ARPA funds beginning in 2021 directly from HRSA and used those funds for COVID-related services and expenses, the Health Department has just begun their ARPA spending due to a complex process needed to facilitate the allocation of over $130 million that was awarded to the county. With this funding in the Health Department, we will intend to initiate some programs and expand others. For example, our YES program. We will have mental health counselors meeting students in the schools, doing their assessments, their clinical counseling at the schools. In behavioral health, we will embark on a new electronic health record system. We're going to combine the system that's already used at the health center, and behavioral health will soon integrate into NextGen. We have put additional staff in HR, behavioral health, and family health services, including many additional CD staff. We're going to do some additional training, have some additional training opportunities for you through a learning management system. We're going to try to purchase an outreach van. It's very difficult getting a vehicle, but Cindy's on it. And then we also want to do more with our media campaign to get our programs and our services out there. As you may recall, our strategic plan ends March 2023. It was a 5-year plan, but about 2.5 years of it was well occupied by a global pandemic. Nonetheless, we were able to still accomplish most of our goals, and if deemed still significant, can be incorporated into the next version. At this week's Board of Health meeting, I provided the Board of Health with the status of the plan on January 18th. I know the unfinished items will be reviewed by leadership, and the details of our next strategic plan will be made known by your new executive director at the appropriate time. Thank you to all who contributed in many ways to accomplish our goals in this inaugural plan, and I wish you success in your succeeding plan. I would like to thank our Board of Health for all their support. This year we experienced some turnover on the board, but we also had some very positive additions. The board members volunteer their time. They're always very supportive, they're right beside us, and so I say thank you. I would also like to thank the County Executive's Office and the County Board for all they do to support our agency. Many of the county board members have shown a genuine interest in our programs and initiatives. The County Board continues to provide financial support, as I mentioned earlier, the additional $1 million to our $10 million levy. Of course, I would like to thank you, staff, for everything that you do. Everything you do on a daily basis. It matters. You truly make a difference in our community. We all have challenges in our life. I understand that. And I appreciate the dedication and the interest that you all bring to work with you every single day. I would like to also recognize the leadership and management staff. There's absolutely no way that we would be able to accomplish what we do if I didn't have their assistance and their guidance and their leadership. I feel confident leaving this agency with many competent individuals. And finally, I'd like to formally introduce your new executive director, Elizabeth Bellata. I am completely confident the agency is in very good hands as I plan my exit. I have worked with Elizabeth for several years, first in environmental health, then as a member of the agency's management team, and finally in our leadership roles in administration. Elizabeth is a very dedicated public health professional. I have thoroughly enjoyed working beside her the last 7 years. She is innovative, creative, fair, resourceful, and collaborative, among other things. It will be difficult to leave here in exactly 2 weeks from today, but I will leave comfortably knowing this agency is in very good hands. Thank you for all your well wishes since my retirement announcement. It has been a pleasure getting to know all of you, and in some cases, working side by side with you. I'm so blessed to have spent the last 33 years of my life enjoying what I do. I hope you can join us on Friday, February 3rd to celebrate my retirement. Take care of each other. Take care of this community. And I wish the best for all your futures. I'd be happy to take any questions if you have them. Okay. Thank you. Wait 1 second. I'm going to give Elizabeth a minute. For those of you who may not know her or have not met her, we'll just give her a couple of minutes here to say hello.
Well, hello. Yes, I am Elizabeth Bellata. Thank you, Sue, for everything that you have done for this agency. I have some very large shoes to fill and some high standards to hold up, so I will do my best. I'm not sure if you know, but I did start here in environmental in 1989 as a sanitarian, and I stayed for a few years, got my master's, and I did leave, and then came back in 99 as the program coordinator in environmental. Moved through environmental and then into administration. So I have been with the agency a long time. I know quite a few of you here, and I look forward to learning more about all of the programs and meeting everyone. I visited the branches. I had Cindy's position at one point, so I have been around the branches in the past and the community health center. I take public health very seriously, as we all do. We do something here that the county and the community need. We fill a very vital need, and I just would like to say thank you again, Sue, for everything. And I guess that is it. Thanks. Have a lovely weekend, and I will see you later. Thank you.